How are you building up to the assets that they do game nights? Build that.
Okay, you're being recorded now.
Yeah, we could. Yeah.
Good morning. Thank you all for attending. My name is Harrison Pierce. I'm the chair of Health and Human Services. Let's see. Alyssa McKenzie is on vacation, so Barb has volunteered to be the secretary.
Yeah, good luck.
Thank you, Barb.
And let's see. The first order of business today is approval of the June 6th, 24 minutes. Any questions? Corrections?
Motion to approve.
All in favor? Aye. Any opposed? Thank you, Alyssa, wherever you are. Reports. Health Department.
Jen Eielson, Director of Health. So environmental health updates, you have all our numbers. We did have one new food license issued, that was Cinema Lab at the Playhouse. New food service plan review for a coffee shop at the train station. And then all the other normal building permits and restaurant inspections. All the pools were completed, all 21 were licensed and completed by June 30th. All the 41 out of 41 salons have all been relicensed and inspected by June 30th as well. It's the first year we had them all done by June 30th and didn't have to threaten anyone with closure. So that was nice. We had a total of 54 trucks inspected for June. So they're all relicensed for the next year as well. I have a new lead EDLL, elevated blood lead level of a child under 6. The mom contacted me before I even got it in the state database, so I was able to go out the next day and do a full risk assessment with her of their entire house and their whole property, and then go over all education materials. So by the time the state contacted me, I already had it all essentially done, so that was nice. That grant, we just completed year 5 of the 5-year grant. I submitted the report, the reimbursement just yesterday after getting Deanna's signature, and that was for $4,993.74. The new 5-year contract I have not received yet. It's still pending in Attorney General's office. DPH said we should all be getting them sometime in August. And when I get that new 5-year contract, I have to bring it to DOS, obviously for their approval. It's over 10,000, but and it's slightly lower than what was budgeted at $400 less. But like I mentioned before, that only equates to about 8 hours, so it's no big deal. It's not going to change anything. Community health updates. We continued with the QPR suicide training. The next one is at July 19th at the library. The blood sugar screenings continue at both Lapham and Schoolhouse. We took over the blood pressure clinics, so we're doing those too at Lapham and Schoolhouse. We have an event tomorrow at Lapham. It's all about home safety, which is kind of the precursor to our fall matter of balance class about, trip hazards in the home and that kind of thing. And we do that with Kathy Collins from Lapham. And Kathy partnered with us on the Staying Put sponsored event we did in June for maintaining safety while driving. And then we did the skin cancer screening, which went really well at Schoolhouse. 2 actually were identified, and Dr. El Demol is going to be taking care of them pro bono, which is, I think, wonderful to do the follow-up care.
And on the blood sugar testing, that's a relatively recent program, isn't it? That maybe
we've been doing it 2 years.
Yeah.
After COVID.
And they get a quick result. is that correct?
Yeah, we have both, the standard way and then the rapid A1C, which the A1C shows a 3-month screen. Yeah. And then they get it written so they can give it to their.
Is that are we finding cases and then, you know, in a good proactive way, is that?
Yeah, and that's the whole intent, is so that they have that information in writing from us to give to their doctor.
Okay.
Because going for a yearly, there are a lot of changes year to year. So now
Do we bill for that, or is that something we can get a grant for,
no.
no, it's not?
And then the skin cancer, we're gonna do another follow-up at Schoolhouse in 6 months. In December for another one there. And then Dr. Eldemol also offered to do one with our fire department. So Shannon's working with our fire chief on how the logistics of how that would work to do free screenings for our firemen. And then in another one in October that's specifically geared towards seniors that we're gonna do at Lapham. So Dr. Eldemol's been great working with. Ellen, our nurse, did the EpiPen training and allergy awareness training as well. Ellen also did a men's health talk for men's club at Lapham in June. We're also the Walking for Wellness Club. That's Shannon partners with Kathy Collins again from Lapham. And that's been going really well. We've actually had about a dozen showing up and some new people that haven't even, you know, weren't really part of the Lapham programming because it's sent out. I sent it out to my health group in Everbridge and I have over 1,400 people in that now. So it's that's been a great way to get a lot more people at all this stuff too. And people, the feedback's been phenomenal because they had no idea, you know, that we even did half of this stuff because before we didn't have a way to communicate. So I love that, you know, our first selectman, Deanna, came up with this idea because it's been a great way to get the word out. And as we'll talk later about What's Nile was another way for me to get that information out as well. Trainings are going well. And then we also are in the middle of planning our, not only our fall programming, but like back to school immunizations. I'll be sending out through Everbridge at the end of July, again, reminding parents, you know, certain immunizations are required by law, and if they need them, they can get them with us. That's provided for free from the Vaccine for Children's program from the state BPH. Another thing to mention, Dr. Andrew Gerber asked me to be on the panel on July 24th at an event that Silver Hill is holding with former Congressman Patrick Kennedy, who also wrote the book Profiles in Mental Health Courage. And that's going to be held at the Hilton in Stamford at 5 p.m. So, and then leading into all our charts, as you see, nothing's exactly going down here. And then I added a new chart, which is the mosquito surveillance that begins every summer. Unfortunately, we are no longer in the white, we are now yellow. We did have a positive of West Nile virus later that afternoon after I sent this out. So I took the opportunity to send it out through Everbridge with all information on ways to protect yourself, both on your property and then on your person. So, but it's totally normal to get a positive mosquito, happens all the time. So it's just a good reminder for everybody that it is that wonderful time of year with this humidity.
Like they found a home in Greenwich. I hope they stay down there.
Yeah. It was funny when I called the I emailed Deanna about it. She's like, that means we're no longer white. I'm like, no, we're yellow.
Just for my, how does Everbridge work when you do this? Do you have to just sort of, do you do it on your own?
Yeah, I do it. So me, Public Works, Public Safety, Police and Fire share one. And then Deanna has hers. And then Russ Times has for all the emergencies. But yeah, people opt into what group they want to hear from. And then I go in my group. Some I have templates for, like the blood sugar and the QPR, because I do that every month. I created templates, so I only have to change the date. But the others, you had to go in and actually make it, put in the pictures, write everything. But you know, I use this so much through COVID, it's like second nature to me. And then I also post on our Facebook page. So yeah, it's been a great way to get the word out, and we grew over 200 people in the last week and a half. So I guess people do want to hear from us.
And Norwalk Hospital sent out the community health assessment. Did you want to talk a little bit just about that?
So what we talked about like over a year ago with this now, it's been painful. I have a meeting tomorrow at the community health group with Norwalk. Now the state funds the hospitals to work with local health departments to do what they call a community health needs assessment. Then from that, they create community health improvement plan. So our catchment area is Norwalk Hospital, which is New Canaan, Wilton, Westport, and Norwalk, or to Norwalk Hospital. So part of that is the first part, the needs assessment, is doing the survey screening. Right now, they're not ready for me to launch it to the residents. That would be a separate survey that will get, they said maybe in the beginning of August, at which point I'll send it out to my group of 1,400. But right now we're at the point of just sharing it with healthcare providers in our area. So I sent it, had Shannon send it to Waveney, all our doctors we work with in town, then like, you know, the YMCA, all that kind of stuff. But the point is to catch data, and we need enough data from different groups about, you know, what they think the issues are in our town, because our issues are not the issues that Norwalk faces. I mean, they're usually, Peter and I have been on the group in Norwalk Hospital now for many years, at least 6 years, 7 years. So
I think I got that yesterday from Lee Bonson. The issues are very vague. I mean, they range from like weight loss to like, you know, food insecurity to.
I thought it was overly simplistic, and I'm not sure how that's going to be drilled down into information, you know.
Usable.
Yeah, but it was a survey, it came out of Survey Monkey, and they just put it in there.
Survey Monkey, huh?
Yeah.
I mean,
Really sophisticated.
right, like where before it used to be that there were subcommittees that Peter and I would be a part of, and each group would get to be part of it. Now it's not like that. They just create the whole thing and here you spit it out. So it's not the collaborative effort. Maybe when they change, they're going to be taken over again. Peter, you know more about that. I don't know. So maybe they'll change back to the way it kind of used to be, you know, it's hopeful, but I doubt it.
We asked Peter to
If
explain.
they create more work.
Yeah.
Yeah, it's a big lost opportunity, which Jen and I have always said, because there's real money behind it. It's state, it comes from the state, but they don't turn it into something super actionable. And because they're trying to summarize very different towns, they wind up with really general categories.
Yeah.
And they do kind of cover everything, the way they define things, but you don't have the sharpness of definition, which is to me what's so exciting about the survey that we'll be doing in New Canaan, which you know, we definitely have the opportunity to input into, you know, Jen, things that are really on your mind, and your Marcy, you too, to get into this survey, which would be very much about New Canaan. That's supposed to be a very actionable survey, real data, which I think we're all really excited about.
Does that tie in with the Data Haven study that?
Yes, Data Haven has a partner in it. And Data Haven helps create the equity profiles for each town that they, again, they're paid to by the state to create.
Yeah.
And I actually worked with Mark Abraham from Data Haven to get New Canaan's equity profile better and more specific, because like I showed you guys last year, it was getting way too broad and not New Canaan enough. So I spent a lot of time with him to.
And Lauren, if you'd like a copy of the actual survey they sent out, I'm sure.
Yeah, that'd be great.
Get you.
Or cross-reference with that research.
Yeah.
Yeah.
It was, I mean, it was so generic. It went from geography, what was geographical, to, you know, basic age cohorts and then a big other category, just.
You go and pick three.
You go and pick 3, right? And there was no ranking at all.
Well, things like affordable housing, a health department's not gonna solve.
Well,
So, you know.
there was a lot of affordable housing.
Yeah.
In the survey that came out from Nuance and things of that nature, and again, I think it's missed opportunity, as we're all saying, and hopefully we learn how better to drill down the questionnaire so that it actually produces meaningful.
But interestingly, the state health improvement plan is no longer housed with EPH.
I know.
So that's an interesting thing where they still have this legislative mandate that we do it at the local level, but they don't do it at the state level. So.
It's dollars at work.
Yeah.
West Nile used to be a late summer autumn disease, now it's shifting.
Well, more year round stuff.
Little warning.
Or North Florida.
The other thing, lead, do we know the source, was it paint?
It's chipping thing.
Yeah.
Old.
That's it, my friend.
Thank you, John.
Great.
Human Services Department.
Okay, I am Marcy Rand. I am the interim director of Human Services, and bear with me because this is my first official report, and following Jen, who's old hat. For our fourth quarter, for adult and senior clients assisted, those are all clients who I touched on in some way. They ran from 208 to 212. Youth and family, Jackie has 142 families, 145 total children in her. And our domestic violence cases actually were 0 in June, which is a nice thing to see. Referrals and assistance, that's any kind of assistance with state applications, such as like SNAP and Medicare, unemployment, anything that will serve assist clients. In June, I had 37 and Jackie had 41 clients that we assisted with some sort of referral. Outside agency meetings and continuing ed. I attended the New Canaan Behavioral Health Alliance, the St. Vincent's Behavioral Health Program description. That was actually very interesting. Silver Hill Grand Rounds. The topic was Tackling Hawaii, and I attended a Darien probate court hearing. I attended a continuing education event on healing after trauma. I had a meeting with Russ, our Health and Human Services Commission liaison, and on Wednesdays I go to a Nuance health rounds, and that is always very helpful because there are, Norwalk Hospital is the captain for New Canaan, and so some of my adult senior clients will be on that round. So that's actually really helpful because there are sometimes clients that I didn't know about who are on their radar that are good for me to do that. Jackie attended the Canaan Behavioral Health Alliance as well. She also went to domestic violence bystander intervention training. She attended the New Canaan Abuse Prevention Partnership, and she went to the Youth Service Bureau Catchment Area meeting at the end of June. And our food pantry, that was really, it looks lower here, but we're concerned about our budget on our, we have about $60,000 left, and we used to be really flush for our food pantry, 180 households in June, individuals, and 90 shoppers. But we are running low on food, and we're gonna have to do food drives. We're gonna have to really buckle down on that. Coffee with a cup.
Before you go to that.
Yes.
Is the St. Mark's Garden now producing?
It is, yes, it is, yeah, and some of the elementary schools do as well, but I think what we're gonna think about doing is maybe having some schools do a back to school food drive And St. Mark's actually has never done a food drive. St. Aloysius has, but we may ask St. Mark's to do a fall food drive and let St. Aloysius do their Thanksgiving food drive. Just because like it's like we thought we would never not have enough, but like, you know, and so I think
Any reason?
$2,000
Any reason that
it's just donations are down. Donations are down, but I think if we do a couple of food drives and we put it on Instagram or something, say it's that just
Get the word out.
yeah, it's just sometimes things get forgotten. And so, I mean, you know, we're not on high alert, but that's gonna be something that we're gonna have to focus on.
The local grocery stores though, didn't they contribute as well? Is that dropped off at all?
Walter Stewart's has a drop off area,
Okay.
yeah, that shoppers can choose to purchase and put.
And that's dropped off?
Yeah.
That has, okay.
And that's someone from Public Works going to bring the truck.
Okay.
So
I
we are
certainly get some local businesses to support it.
yeah,
and things
no,
like
I
that.
think we just have to think a little bit creatively.
Well, if you wanna write something up, we can send it out either in Deanna's newsletter or through my.
And then Jackie sends a monthly newsletter, so that I think we'll do something sort of cute with like food pantry and back to school kind of combined and get that out there.
I mean, we do over 500 meals a day, so I mean,
Yeah.
if you know, just find a way that we can.
Cause the
Help out
PD
with
did
it.
do a post about the food drive.
They did.
Cause I shared their post and so did Enza on town page.
Sure.
So I think that Nicole is gonna do like an official, like actual drive, not like, hey, the food pantry needs stuff, but like she's gonna do an official drive outside actually and collect everything that she can.
You could probably ask the New Canaan to put it in there.
Yeah.
Did you hear about it or something?
Right,
You know?
we'll think of some stuff, I'm not, you know, it's just that it's lower than it has been.
Yeah, this is new, I don't
Yeah.
remember that we've had an issue.
Well, I think during COVID, we also did a lot of financial donations and stuff, so we were super flush with money and that's starting to be used, you know, so, which is what it needed to be done, it needed to be used down, so,
Why don't we just contact St. Mark's? They can get it going now, we have to wait till Thanksgiving for St. A's.
no, I think that's what we'll do a back to school food drive as well, yeah.
You guys hear me on Zoom? This is Jen Zonas. Hi, I'm not wearing my town council hat as I just because as Interfaith Council can help, Marcy. So I'll reach out to you because we have a team of 10 liaisons and we can get on this. So I can do that.
Fantastic, thank you.
Sorry for.
Thank you. Support groups. We are still doing a monthly coffee with a cop at Lapham, and I am still hosting Life Reimagined at Lapham with Ron Rockefeller, who's a retired social worker. We had 10 attendees in June, June 20th. And then my grief and loss of a spouse group held at Wavy in the library, which I have to say, redecorating is beautiful. Unfortunately, that has gotten, you know, it's gotten popular. It moved from 2 people. We now have 9 regulars. But it's really nice to see because they come weekly, no matter what, and it's coming. They say through the week, so I'm proud of that. So thank you very much. I attended Jen's blood pressure clinic on June 11th. It's a great way for me to see the schoolhouse residents who I don't regularly see without that. So it really made a tag along. Our vulnerable population list, it went from 107 to 85. That was because I reached out to every one of them when Russ sent us that email about Keith like 2.5 weeks ago. And I got a lot of, you know what, I'm on your list, I'm 65, it was because of COVID, please don't, you know, that good, please don't call me again. So, you know, 85 is still a great number, but this is a true, I think a true, really vulnerable number. And I know with the heat this coming weekend and stuff, I will not call everyone again because I don't want to like drive them insane, but you know, the ones who I think are very vulnerable or who are on oxygen Parkinson's or something like that, I will, I'm
Do
gonna.
you have people on your group who have no AC in their house?
There are
Or-
a few,
Who are really.
there are a
pressed
few,
for
but most of them have AC. Even if it's a window unit in one room where they can like sit quietly, yeah. Energy assistance, that is finishing up, so we did not have any of that. Renters rebate is also slowing down. It went from, we had 53 residents in May, I had 5 in June.
Is that when, I mean, rents usually, is that when?
It's a state application for low income or disabled, and the state will give a rebate. It gets sent out in November. It really ranges based on income and how much you pay in rent. It can go from 900 to about 250. It's a one-time check, but for those people who are, you know, paying like 300 a month, it really does help if they get a $900 check.
Sure.
Our back to school program, like I said, is going to be starting the end of July. That will be a busy time, and the rest, you know, I won't bore you with all these numbers that I sent you guys, but if you have any questions, answer those.
The silver urgent assessment, we have numbers for June.
Did not get those, no. I do know though that the behavioral health website has not gotten any requests for anything to put out there. We gotta check that daily. So for some reason that is not got some good reactions. Yeah.
And I just want to ask you about the intermittent community event support, the vigil, the $1,400 vigil.
Yes.
Is that just the thing you usually do, or?
That is, yeah, Paul asks for bracelets and stuff for that in August.
Yeah, that's standard.
August 29th.
He never asked for more money.
Yeah, no, I'm just curious.
Many more.
Makes sense.
Thank you, Martha.
You are very welcome.
Whole business, agency liaisons, I think we're settled in, we're communicating, we're evaluating, right? And go to the left, we got it. Okay, our last meeting, we did discuss priority areas for health and human services going forward, and Peter and Barbara volunteered to just summarize things, so they did. This is a handout, it's a draft. Pass that around. Do you want to comment?
Yeah, so this is our effort to kind of channel the group's discussion over the last couple of months. This is draft. Underline that 3 times for everybody's input. And it's also kind of provisional because we're excited about the community survey that's coming up, at which point we really revisit these priorities based on the data that we get from that, but we need kind of a working understanding. And again, the goal is, because there's so many programs and issues that have been sort of around town, the goal is to provide priorities as we can, focus on everything, we can't fund everything. And this is an effort to guide us in our looking at budgets, looking at governance, and which outcomes we're going to be focusing on most as a commission. We try to write these really broadly on each of the categories. So if there are particular issues not specifically named, they're meant to be captured under these, and they're also written in a way where we think these 4 categories cover all demographics. So you know, kids, seniors, everybody sort of in the middle. So it's really meant to be pretty broad. So Barb, you just want to do a quick.
I was gonna just, you know what I was thinking is everybody should maybe just read it. You know, just read the 4 points and then we'll talk about them, just because I think it's, or you want me to just talk to them?
You know, I think we can revisit this.
Okay, all right, because it's just,
Sort of
okay, thanks. All right, I just was thinking it's sort of hard to.
Unless,
No, this is obviously behavioral health and mental health, no surprise, that's the critical issue that we've all been talking about since, you know, post-pandemic era. Mostly our young people, you know, have had, you know, have seen the implications across many realms, and this is obviously a big issue that Norm has been addressing. But in terms of, yeah, specifics, you know, this was suicide ideation and substance misuse, which is the second point, that's really closely related and it's definitely key, you know, to addressing this issue. It's harnessing community capabilities around awareness, prevention, intervention, and treatment. You know, last time we talked about wellness and we said how maybe that should be our focus is sort of a broader, like how can we help inform wellness? And I think these all sort of fall under that category. Jen and her group did an incredible job with emergency preparedness, and I think watching them during COVID so masterfully building the partnerships with the town and EMS and police and fire departments. I feel like we are in a really good place there in terms of, you know, preparedness for hopefully nothing will happen again, but it's just really great to see that actively.
You better not just jinx me.
Oh, I don't have that kind of power.
I don't have another thing to give me, I'm done.
But you know, I was gonna ask, we would just talk to social connectivity. So I'm gonna ask Raquel if she'll talk to social connectivity.
Yeah, no, I can speak more specifically into it, but really that idea of it really being a broad piece of our health that is very connected to your physical health as well. And that piece is probably often missed. And so if we can encourage that more within the community and fill that time, you know, whether it's for the young people leaving for college to understand that here home in New Canaan, they have an ability to come back to and have those relationships and kind of that stability, whether or not that's present in the family unit, we can create it within the community as well. It's can be really powerful, but then that also extends, as you were saying, through you know, seniors. You know, it doesn't necessarily surprise me that some of the support groups have kind of gained a very strong presence, right? I mean, that's kind of key. So I love that that's happening.
So Jen, COVID really prompted this department, State Department to get involved to this extent. It didn't exist before that.
For what?
For emergency preparedness.
We've always had it since 2001, the FEP grants have existed. And locally, Mike Handler and me and Pete, police, fire, EMS used to meet every single month. And I had changed our mass vaccination plan and all that, because we used to be linked with Norwalk. We would have had to have gotten 20% of their residents, which would have doubled our population. In the year leading up to the pandemic, myself and Mike Handler worked on changing that whole plan, and I wrote the whole plan. But no, that's why it was so seamless with our group, is because we were preparing for literally years before that. And we still meet every single month, all 14 towns of Region 1. So
I think the goal here is that tends to be a quiet issue until it's not.
oh yeah.
And we're making sure that.
Oh yeah, no, 100%
You're doing it, but from our signaling that this is incredibly important, even if it's not in the Canaanite every day.
Right.
It may be, it may dominate.
Well, it's like a restaurant inspection.
So
You do that to prevent foodborne illness, you know?
I mean, one of the things we talked about, I mean, you know, thank you guys, you know, for putting this together. But one of the things we talked about is coming down to very specific, measurable indicators that we can look at over time to see if we're moving the needle on, right? And this is extraordinarily broad. And our, you know, is the expectation that we're going to take these and try to bring them down to some very specific metrics like suicidal ideation or opioid abuse or isolation of seniors or whatever it is, emergency preparedness. I'm not sure what kind of metric we would put on that, except when a pandemic happened and how much of that overrides with what Russ Kimes is doing, you know, that type of thing. So I think my recommendation, that's kind of the next step, is to try to drill it down into those very granular measurables.
And I would just piggyback on that to say that some of those metrics that you just specifically mentioned are a little bit like the end game metrics.
Right.
And whereas those are important, you should probably peel the layer back a little bit to how many people are showing up to some of these community groups that really provide that stability. Are there groups that are multi-generational in nature that we can continue to encourage to kind of boost a social connection that looks a little different? But like kind of looking at that
Prevented on all of that.
Just so that, because if we're just focusing on suicidal ideation, it's great, obviously, to get that number down, but that doesn't tell us about the people who are like, almost there.
But that's the key part of the wellness piece, is supposed to capture all of the steps, or quote, down the funnel toward where you've got really serious problems. But that this is absolutely meant to be just a discussion starting point, and hopefully over time, Russ, it will become richer. With the data that we're going to get from the survey, and then we'll get to the more specific metrics. I think that's part of the goal. This is just.
Well, to her point though, I mean, if you have a metric at the end that you're looking at moving, you're going to move upstream, right, to look at prevention, so that at the end you're actually seeing the downflow and is it having an adjustment. So we're all, I think, saying the same thing in a different language, but I think that is the direction that to me makes most sense, because we can't be doing everything, right? I mean, we look at these reports, it's like being running a healthcare system. I got 10,000 data points, okay? Well, I have data points, so I gotta look upstream and see how can I impact those data points, right? And so that's why I'd like to see, me personally anyway, as a commission, how can we hone in on those 2 or 3 things that are upstream and look at those measuring tools. So,
and it's interesting because the way I think about it is like there's a difference between health span and lifespan, right?
Sure.
So health span is that number, but you can have a poor lifespan for those last 10 years, right? And so if we can try to hone in on the metrics that really define lifespan and actual quality of life, that would be.
Talking about metrics, I was just gonna say this for Lauren's presentation on their study, but because of reading some of the past things and your desire for data heavy, we have the data heavy information, which is 2019, and most of those studies are delayed in terms of getting here. So I'm really looking forward to having something, not only being specific, but time. But the key thing that came out of my looking was that Data Haven is showing this is 2019 pre-COVID, major problems in the senior 65 and up group in mental health. That's not showing up in the urgent assessment by a factor of 20% or something like that. It's like 8% or something like that, I think, is the number of seniors in the urgent assessment.
Well, I mean, that's
disconnected.
That's Lauren's help in the community foundation. I certainly think again, nor drop the ball or the opportunity is the data lack, right? And we're reading studies now in medical journals in 2024 that are based on 2019 and 2020 data specs. So if we can get something that's more
and I'm delighted Jen is now sitting on the state level as they're beginning to think about these things, because historically, and the divorce from being linked at the waste to
we're sending Washington
now pretty much over.
It also may be that they're not candidates for the urgent assessment, like it might be that that's why my support groups have increased, like they're not a candidate for like intense, but they're reaching out through, because my support groups have gotten larger.
They might be afraid to make a phone call, but they're,
Or they're not there yet,
or
they don't
right.
that.
I feel like they're
Essentially.
right. Those are the issues that.
I'm talking about that's what this guy come there shrink.
Right, exactly. Yeah.
I think we have to move on.
I tried to get Kevin to go with me, he wanted that.
Just open a poster,
Or like, you're just gonna wrap this up.
just to wrap this up, please feedback on all of this to us. This is a work in process, and thanks for all you've done today. It's probably a great
Thank you for
fit.
doing that.
Yeah.
It's great.
Okay, on to new business. We're fortunate to have Lauren Patterson today.
Lauren, you can sit here.
You sure?
Yeah.
Well,
no, please sit here.
We want Lauren.
Alright.
I'll just call on Lauren. Good. So Lauren's president and CEO of Penn Community Foundation. And we're happy to have you here. Just want to give us a quick overview of the function of what the Community Foundation.
Sure. So the Community Foundation has been around since 1977. We were an all-volunteer run organization for about the first 20-25 years or so. Since then have been staff, but still largely volunteer powered. We have about 200 volunteers every year that are either on our board or committees or out doing grant review. And a large function that we're known for is the kind of annual open cycle process, whereby we typically get 115, 120 applications for funding from local nonprofits. That's, you know, New Canaan-based nonprofits, local providers that are in part serving New Canaan residents, and then others that are serving neighboring communities. So we run a big annual process to kind of vet all of those organizations and move the community's contributions to the foundation out to these organizations. So we're funding everything from health to social services, environment, arts, culture, you name it. There's something that we're likely touching. We do, although over time, strategically focus on different issue areas. And that for us has been around behavioral health for the last 6 years running now. I can talk a little bit more about that kind of background in a second. And then other things the Community Foundation is known for, we also run donor advised and other charitable funds. So individuals who might look on us either for advisory services or actually house their with us. And part of that is trying to help get people to connect their dollars with the causes they care about. So we're their kind of advisor on that nature. So the behavioral health background. So a little bit about me too. So I've been with the foundation will be 8 years this fall.
Sorry, I remember interviewing her. Like,
8 years this fall. I've been working in community-based philanthropy for about 17 or 18 years. I worked in DC and suburban Maryland and Virginia, and I came back up this way where I have a family in this area. And community philanthropy is all about understanding what is going on within a community and not just coming in with like a perspective and like we think this is the best thing now to be funding the community. You are within the community and you're partnering with so many people and organizations and local government and so on that this is meant to be a really seamless way to invest in a community. So when I got here, I had no preconceived notions of what New Canaan was or wasn't, or what people needed or thought about, and had lots of conversations with folks in leadership levels, but also just a lot of like coffee meetings at LPQ and so on. Just like, what are you seeing? What's changing? What are you concerned about? What have you been trying to do as a community, but it's really not making the progress we'd like to see, and so on. And people obviously didn't say behavioral health, but they were talking about stresses within the student population. The then executive director of New Canaan Cares, Meg Domino, who probably a bunch of you know, was talking about you know, the #1 thing being requested of her the teachers that she worked with, first grade teachers, was stress management. And so like, here's something going on with our young students even. There were family dynamic issues coming up. The opioid crisis was very much in the national news, and we had also unfortunately lost a number of either residents or young adults who had grown up in New Canaan and moved elsewhere. And so things sort of started coming together around this issue area. And so the Community Foundation is a generalist, right? We don't, our staff team and the volunteers and so on aren't experts in particular issues. We lean on that expertise and we help bring people together to work on an issue. So what we started to do was build a committee of people who is actually still standing. It's 20+ people now, our behavioral health committee. Some folks have been on it the past 6 years running, others have sort of cycled through or added on. And it's meant to be this volunteer committee that's built expertise, and we've also brought in more expertise over time. So physicians are part of that group now, but also with a lot of individual residents and volunteers that have perspectives on their kids are different ages, had different school and sports experiences, they run in different social circles. It's a broad look at the community issue. We formed that in 2018 and 2019. We hosted 2 different community listening sessions to inform our work. Those were about 50 or 60 people at a time in the old basement of the old library. And we did assigned seating at big tables so that we knew the people seated together were about 6 or so people at a table that didn't normally work together on this issue. So you had, you know, the head of a church with the superintendent, with the social worker, with the mom who runs the Girl Scout troop, with the, you know, so these were folks who we felt if they could identify what were common challenges in the space and then also potential common solutions, that this would be a pretty good idea of what could really move in the community. The 3 things that came up in 2019 still hold. So number 1 was streamlining access. So when you're or a family member or a friend or loved one are in crisis, it's not the time to be navigating what's a really pretty confusing system. We are lucky to be resource rich in programs and providers, but it's still really hard to find the one that's a fit for you, or that doesn't have a long waiting list, or right, any number of these things. So we've done a couple of different things to make progress in this area. I think the town's investment of ARPA dollars in the urgent assessment program, and we were also like in the wings helping stand that up, and now we're one of the private funders of the program. Right, that's a really important step in. That's a pick up the phone, talk to a human being, sit down with someone and let them help you walk you through this process, and then that tailored referral and working it out is really important. The Behavioral Health Alliance website is also intended to be another way to get people to just understand that that website on its homepage has the urgent assessment, right? So this is a critical need. It also has R2R, which is resources to recover. Again, it's getting a human being on the phone who knows all of the local providers and systems. And so we don't want people to be scrolling through Psychiatry Today and just like going by zip code and like, well, maybe this guy's good, right? Otherwise you were turning to a friend or a neighbor to say, well, who did you use when Johnny had an issue last school year? Or this could help streamline and access, bring access to a lot more people. So access was number 1 in that community listening session. Second was anything we could do around stigma reduction. Remember, we're having the conversation early 2019. So I think that the pandemic really did help, right, with stigma reduction, but not equally across all age groups. And certainly it's a cultural thing, right? Any of that cultural change just takes a good amount of time. And I don't think 4 years out from the start of COVID that much time that we've changed. So in practice, still stigma reduction things are important. I love that you all support the vigil, right? That's been a tremendous thing that Paul and his team have done just to bring visibility and conversation around these sort of topics. And then the third area was around data. So we have national data, we have state level data, but we really don't have the hyper local data as reference it's current too, that a community can say, okay, here's really where things are going on, or here's a data point we didn't expect to see, like, let's dig in on that. Like, what is upstream from there that's going on? To be able to say, are we putting our resources in the right places? Then after we put the resources there, are we seeing outputs or outcomes eventually change in a year or 2 or 3, 4, 5 years time? And so that's been a harder one to move on, right? That data is a bigger ask when you're talking about community-wide. But I think now we have a really great opportunity. The New Canaan Behavioral Health Alliance, as you all know, is about 30+ organizations and even more people that participate. And so the Alliance can be the administrating group of this survey. So just by way of the membership-based group, 30+ organizations with different tentacles into the community, we can reach a lot of folks and think about a lot of different age ranges and a wide variety of issues. There is some opioid settlement money that you all recommended be applied to this, and then the Community Foundation is additionally putting resources into this project. So either to help complement the research arm of it, if you will, and or the follow-on. So say the survey comes out and it's saying something unexpected, or even if it's saying something expected, but we need to immediately provide certain access to resources or certain programming in the community or something for a particular subpopulation, that there could be resources lined up to do that in a pretty quick way, and in a responsive way. So right now what we're describing is we're going to come up with a good name for it, but to think about it as a community-wide well-being survey, right? So it's not a mental health assessment, not behavioral health, it's a well-being survey. And I think we would like to understand some broader things, including aspects of the community that are helpful. And we want to remember to keep investing in those things, not just where are there issues that we might have to look at differently. So for example, asking questions that I think this group has discussed, are you part of one or more social groups in town? Do you go to, do you have a church or a synagogue community that you're a part of? How many people do you feel like you can reach out to in crisis? Do you, those sorts of things that get at, I think, a lot of the strengths and assets of this community. And I think will show some correlation, right, where people are feeling isolated and maybe are missing some of those components. So there's interesting opportunities in there. We're in the process of kind of crossing the T's and dotting the I's on the researcher contract. The researcher that we're planning to engage with, her name is Nina Chanana. She has done surveys all over the state, but a lot in Fairfield County specifically. Got my list from her. So she's done policies in Greenwich, Darien, Trumbull, Stratford, Fairfield, Westport. Might be missing one more in there, and then a couple also in the northwest corner of Connecticut, so Torrington and Bristol, for example. And what we've talked through with her is really a phased process for the survey. And phase one is really focus groups or kind of community meetings, so that we can bring people together and have a conversation about what do you want to know about your community, what things are you concerned about, how would you phrase that question? Are we really going to get to like what we're really driving for in this? So we would love to include you all in that, and we can figure out the format of a special meeting that's town leadership specific or this commission, and then we'll have other groups, say the schools and so on. But there will certainly, we've talked with the faith community about having input. They were really interested in doing that. And then I think we want general residents to feel like they can show up and be heard on this as well. So the intent is to host some of those kind of late August and September so that we can fine tune the survey tool in September and then administer kind of October, November. And that phase is intended to be an adult specific tool. So the thinking is with the adult specific tool, we can get an individual resident information and then also ask them some set of questions that it refers to the kids in their household, right? And so it doesn't yet get to the youth direct information, but it starts to get us a bigger, broader picture of things. It would give us time that the information is collected, summarized, released back out to the community, say kind of December, January. And then in the spring, we can work with the public and private schools to fine tune what does the methodology look like with our youth population. Thinking really about piloting with the youth, and there might be some qualitative that say focus groups and some that's quantitative, but there's a lot more to really parse out in the youth population. Are you serving 8th graders and 11th graders? Are you serving a variety of ages? How is it administered? But we do have participation right now in public and private to varying degrees in the working group and kind of working through this whole process. So we would eventually have that that spring pilot with youth data, and then we can do a second release of information later in this fiscal year.
I'm exhausted.
It's a lot to take. This project is much more expansive than I visualized.
Okay.
I thought we put together some little questionnaire, et cetera, that was benign enough, and the questions that you posed were relatively benign, not getting to the real nitty-gritty information that we want. But what you're talking about is a year-long process of interviewing, accumulating data, receiving. It's big.
So how big is the workforce of people working on this project? Because that's like, this is not a little side of you.
Sure. Well, so the Alliance has a work group that's meeting weekly right now. That's about 7 or 8 of us who are like hammering out the details of this, but the research is really gonna be critical. I mean, she has tools that she can lean on from other communities. We don't have to reinvent the wheel, but she's really thoughtful. I mean, every town is different, right? So I really liked that she's helped us build in this process at the start to have these focus groups or these conversations.
Did you see what she did for some of the other towns? Is it something that's done here, we'd be thrilled to have, because it was a really a high yield undertaking.
I do think it's gone well in other communities. Other communities have focused on youth surveys specifically.
Okay.
So ours is a little bit different because of the adult additional focus, and actually we're leading with that more than the youth survey. The youth survey component, for example, in Darien has been something they've been doing a number of years running. It's tied to a state grant. So they got initially a $500,000 5-year grant. And that's tied to administering the survey over 2 or 3 years, and they've now gotten a renewal on that. Greenwich has that now too. There's really a lot of communities locally that have started to pursue that. So for us, we don't know if that's in the cards or not. What we're working through are what in the survey could match up with the availability of state or federal grant funds, right? It would be great to tap additional resources for the community, but we don't need to build something exactly for that if that's not the priority.
Well, how would you define youth? I mean, do you have an age cohort? I mean, young adolescents, different. How are you defining?
We still have to work through that. And particularly with the schools that we have, right? I mean, country school is serving an entirely different set than some of our other schools. So we have not defined where exactly we would be surveying youth directly, what that age group is versus what a parent is referencing, right? If it's a young child, a 5-year-old, we're not they won't be surveyed. Their parents going to be referencing the development of their child. We haven't set the parameters on the youth piece yet.
Did the Darien results show anything surprising or enlightening or helpful? Because I would imagine their results are going to be pretty close to ours for youth.
Well, that's always the assumption, but we don't know. I'm not an expert on the Darien result, though. I can get you all a copy of those, what they're most recent.
So Lauren, have you taken, because I know the public schools have done these surveys over time and dealing with mental health.
Sure.
So are you grabbing some of that information from the public schools and sort of using some of those survey metrics that they've used?
Anything that's currently existing, and even like I want to talk more, Jen, like about the needs assessment that Norwalk Hospital's right. Anything that currently exists, yeah, right. Let's build it.
Because while we don't have grant funding in the town that is funding this, the public schools do this consistently. It is not something that is being overlooked in the public schools. I don't know about private schools, but
I think they have done some surveys over time, but everyone has like a slightly different rate. We have to figure out how to patch it together, and then the researcher can tell us then if you have this number of people, there is a span of years that's actually acceptable to collect research over and consider it part of the same data set. I think she even said it was as far as like 2 or 3 years. And so we can build something though that we can say is statistically significant, and we get the depth of the population, and then those things could help us eventually access grant resources because we have the numbers to say this is significant in the community.
how do you distribute it?
Every way possible. So it will be electronic. We are definitely planning a paper version, and that's going to be really important for certain populations. So there will be costs associated with that, right? So it's not just the researcher, but it's mailing going to every house, and she has the infrastructure to lean on to do all the tabulation of the paper versions, in addition to she's got the technology set up to in a secure way manage all that electronic data too.
Just to compare ourselves to Darien in terms of cost, what did the project cost, you know?
I don't know what their project costs. In terms of the survey administration,
Yeah, being the same,
I don't know. I can find out though.
No,
On your timeline with, support everything you're doing, of course, as you always know. As you define youth and drill that down and you look at other age cohorts, is this going to be like a 2-year project before we actually, from a commission standpoint, or an 18-month, so we can look at all age cohorts and kind of prioritize what, you know, our funding needs to go
Yeah.
towards.
I mean, the hope is we'll have adult information by January.
Okay.
We'll have the piloted youth information by, so say if it's administered in the spring, by May, June.
Okay.
And then if that was the pilot, we want to fine tune with all the school partners, like how did this best work? It's also possible that this is administered through youth serving organizations in the town, right? So the Live is part of the Alliance or the library, or think about all the other places that kids plug in. But that would have to be kind of a careful process and chart it out a little bit more. School is such a confined, easier place to survey, but we could branch out. But I figure if we have initial piloted data by May, June, as long as things go well and we can fine tune it, we could re-administer in the fall.
Yeah, no, I'm just looking in terms of Health and Human Services, their fiscal year, right, with June, and if we were going to earmark, you know, some of those dollars towards that or take away or look to, but yeah, it would be the following.
But there'd at least be initial information from, so the parents would be reflecting on their needs and their kids' needs in the early.
Even if there's a preliminary report or something before it gets final, I think that
and
could
a
be really helpful.
preliminary piloted youth data, so you would by the end of the fiscal have preliminary.
To me, what's super distinctive here is Lauren and the team have done so much work pulling in all the different parts of the community. The school system's involved, St. Luke's is involved, and all the other constituencies. I think there's someone from Waveney as part of the survey working group, which is very, very unusual. And the second thing is I think you're trying to get at causality a little bit, because the world is changing so quickly. Just think about post-COVID, mindsets are very different. So data from 4 or 5 years ago, it's not that relevant. And secondly, the role of technology, which is immense, in my view, on sort of mental health. We start to unpack those things. And then to Russ's point, how do we build off of the data? Because I know we're going to have a fair amount to work with in terms of our input to budget and our recommendations as of January, which is enough time. But I'm very, very hopeful of what we'll be able to do with all of this, and then it starts a process. Plus, to your earlier point, you continue to gather more data and realize, oh my, this metric and this metric and this metric, these are the keys. Well, then, you know, and then going upstream and then looking at, you know, we talked about this dealing with stress, and we're seeing, you know, younger kids now dealing with stress, and that's alarming. And you're looking at medication being prescribed, you know, for some of those stressors, and that's alarming as well, you know, being now a grandfather. So all great stuff. But I hope we as a commission can come together and say, instead of, you know, spreading the seeds a little bit here, that we can really hone in on a couple of things and make an impactful movement towards us, compared to, you know, everyone gets $500, you know, so.
I'll take the 500.
Veto. Line item veto.
I think it also could lead to a more broader participation by us in what's going on in the community, possibly, you know, reaching out and trying to support specific efforts, trying to make ourselves part of a bigger, you know, that we're engaged in just going on, not just grant making.
Would also be nice if the commission actually saw, you know, the school reports from St. Luke's and from the school system, if they have summarized their data already. I mean, I think that would be helpful information.
And two things, and one of the things that stood out is that time frame piece that the researcher mentioned. Maybe in a post-COVID era, as things are changing so rapidly, maybe an encouragement to challenge her on that to be like, maybe it needs to be tighter, quicker. Yeah, from a collection of data, just because things probably are shifting so much.
She did comment on you know, a couple years ago, how long she would leave a survey open, and now how much work is that?
That's encouraging. But then also one of the things that potentially with the survey is opportunity for, that it sounds like the other towns haven't, is that multi-generational piece that we talked about. That could really lean into some of these possible potential initiatives too moving forward.
You know, Lauren, you may wanna reach out to Sarah, Gary, or planning and zoning, because POCD has the push out on that.
Yeah.
We had over 10%, you know, of the community responding, which is huge, And so that was an unbelievably effective rollout of a survey, and so, you know, maybe you can utilize some of those same.
Great.
Wait, what survey was that?
It's the plan of conservation and development.
POCD.
Yeah,
COPD.
I know, it's terrible. More bad, it's worse.
I don't understand how.
And the other thing I like and I'd like to emphasize is because there can be a sort of a negative, we're looking for problems and all of that. And I think what's really smart is you're also looking at strengths, our strengths as a community that we can build on, because we have, I believe that the community is a big part of the solution. And identifying that, and how can we promote more connectivity, more group activities, support, you know, faith, support, you know, men's club. There are great things happening there. That's a more positive, muscular approach to these issues, which, you know, yes, we need to talk about the problems, but also what can we build on as future strengths for the community. And that's always been your mentality, and I think that's really important.
Yeah, it'd be interesting. I mean, our population has changed in recent years too, right? So, and we have to be disciplined enough to make this a short survey that people will respond to. This can't be like data, right? But I think we can get population information, if you will, in an interesting way. So, like, how many years have you lived in town? Maybe you could imagine new people to a community might be more isolated than others, but maybe because we have newcomers and other great social activities in town, that's not an issue here. But you know, we can structure it in certain ways to understand where people are.
So one quick question, I know you said adult will be done by January and youth by May and June, but you think we'll have like some kind of idea before that? I'm just thinking like budgeting wise.
Yeah, that's where we're really pushing her to have, you know, we're really pushing her to have like a drop dead date. We don't know exactly where in November it will fall, but to wrap the survey so that she has enough time to close it out, to the analysis. She knows we're really driving for December, January. I think January we would say we'd like to do like a public release of the information, right? Invite people back into the focus group, have a conversation about what we're still learning and what now is going to roll into the youth phase of it. But I would hope that internally we'd have more information to share more to like December. We just won't host a public forum around the holidays, but I think for like leadership groups, they can have the early data to inform planning.
It's great that a number of groups are interested and will provide data. But beyond that, is there any financial interest in contributing towards this project? No. And also Silver Hill, I know they're interested, they are part of this, right?
They are part of this.
Is there a financial commitment from them in terms of
percentage
or?
Well, I'm meeting later today, so they have Susanna Lewis from Silver Hill is on the working group with me and others. We're meeting later today to kind of flesh out the full project budget for this. I think the financial commitment in a lot of cases, honestly, is the staff time. And we may think about leaning on Silver Hill's research department, for example, and some help on, you know, doing the mail-ins and so on. We have to figure out the structures for all of that.
Great, it's great.
Well, that's important.
Yeah.
Take it off. We can touch as soon as we can do input and get this whole thing rolling.
Oh, this was so helpful and informative. Thank you.
It's amazing time for us too.
Yeah.
We're trying to wrap our head around things that are so hard to wrap our head
Good, great. Thanks.
Yeah, I think we're coming to an end.
I'm sorry. Motion to adjourn. Very quiet.
So our next meeting is September 5th. Two things Jen mentioned, the Behavioral Health Alliance